Welcome to the Beyond Physio podcast, where we help you move, excel, and inspire others on your journey to your next level with knowledge and advice from experts and testimonials from our like-minded community. On today's episode, I got to interview Theresa Teague, who is a local massage therapist in the Cary, Raleigh area. We got to talk about her approach to how she treats different conditions, why it's important to be able to connect with someone to get the most out of each session, and the difficulty that a lot of people have in letting go of the busyness of life and the stresses out there, and how that can actually manifest inside our body, and how our emotions can also lead to many kinds of chronic conditions because we tend to hold things in. But that being said, massage therapy, I have a soft spot for, since that was my former profession before I went to physical therapy school. So I do hope you enjoyed this episode. We are doing a short series on massage therapists in the local Cary and Raleigh area. So hope you enjoy the series. Theresa, it's been a pleasure getting to know you and also experiencing your massage therapy services as we're doing this series on local massage therapists in the Cary, Raleigh area. So it was a great pleasure to meet you through your husband, David, and I really enjoyed our session. Can we talk about your journey? Because it's interesting. You went from corporate retail behemoth to where you're on your own as a massage therapist. What was it that made you transition from corporate America to where you are on your own?
I went to corporate America because that's what my family or my upbringing kind of thought was the ideal of success. And I went that career because, I wanted to be successful. Another career was, nursing. I didn't want to be a nurse. I didn't want to work in hospitals. So I went into corporate, and I specifically concentrated in human resources. Thinking that human resources was there to help the employee, which we did. We helped the employee, but human resources is more to help the employer, not so much the employee.
It's funny. So, because I think of human resource, I would agree with, it must be for the people, but really it's not the case.
Yeah. And I tried. I mean, I worked in health and benefits, believe it or not, in
really?
human resources.
Oh, wow.
Yes. It was a large corporation. So I chose that, and I thought, yay, I got the HR, I was successful, but I was miserable. Not miserable, just unfulfilled.
Yeah.
So got married, life goes on, decided we were going to start a family. Had some disasters trying to start the family. Finally got pregnant, and I decided that I'm working 45 to 60 hours a week in corporate, but we just struggled to have a pregnancy, and I didn't want to pay somebody else to raise my baby.
Yeah.
But I am not a full-time stay-at-home mom. Nothing wrong with that. I just needed to be out of the house a little bit. So I chose to go into or follow what I always wanted to do and help people, and decided to go to massage school. So luckily my husband had a career that we were able to tighten the belt, and I was able to go to school and leave my corporate job and raise my baby and also do something that I absolutely love doing.
So it's funny because on the one side, you were trying to help people in corporate, and now you decided that I want to make a bigger impact perhaps on someone's life, and also have the balance in having a family and raising your child. Can you tell me more about what it was like being in massage school?
Massage school was phenomenal. I went to this little niche school, and that school actually offered one-day workshop where you could bring your spouse with you.
Oh.
And they taught you some techniques, and David and I went, and it was so much fun. It was full 8 hours. We learned some techniques, and I left that campus going, this is what I want to do for sure.
So it really gave you the confirmation that this is where you should be.
Yeah. It took me a long while to get there. I thought about when I was trying to decide what to do, I thought about going to PT school.
Right.
Started taking prerequisites from the business degree to PT school. When I found out I was pregnant, I'm like, I can't do work and school. And so I originally was going to use massage as a stepping stool.
Yeah.
To like once I get the child established in school, then I'll go back to school.
Yeah.
And I just fell in love with massage. So the school was, they said it was full time. So we went 8, 9 hours Monday through Wednesday. And then we had to do our own clients outside of the school.
Hmm.
And it was the school that I went to had a lot of self exploration. We did a lot of self care. We did a lot of why do you want to do this? But we also did books like Molecules of Emotion.
Hmm.
So it was a really well-rounded education there. It wasn't just getting your associate's degree and getting the business, and not to say that the technical schools aren't a bad, or I know a lot of good technical schools in the area for massage, but
Yeah.
I just felt more comfortable in the little niche school.
That's great. When I was in graduate school, and actually thinking about what you're saying, I actually had, we talked about this, I had a massage background as well
Mm-hmm.
in California. So my massage background was in shiatsu. So I really learned a lot about myself in that process, and obviously a lot of hands-on skills as well.
Yeah.
But coming into graduate school for physical therapy with a pretty good understanding of some Eastern practices and looking at the body as a whole, looking at a person as a whole versus, oh, I'm just going to work on someone's elbow or the shoulder.
Right.
I think it really broadened my perspective going into a clinical, technical aspect like physical therapy. And it really helped me to be able to problem solve differently, I think, and also to think out of the box differently because that's what I was used to from massage school as well.
Right. And one of the things that I understood of physical therapy when I was trying to decide if I was going to turn around and take the step back into school was, okay, I am so used to working with the whole body, the whole person in massage. Now I'm going to have to turn around and start working with insurance companies who say, you have rotator cuff, you can work on rotator cuff, when the problem could be in the ankle and the hip, and that works up the chain of fascia, create the problem in the
Exactly.
shoulder.
Yeah, it's funny because I feel like there's a lot of information condensed into a very short period of time in PT school
Mm-hmm.
that it would be hard to appreciate everything from a holistic perspective in that sense. And I would say that I was fortunate to have that experience going into physical therapy school.
Yes.
Not that you couldn't do it in PT school, but it was coming into that with this background knowledge, which was very helpful
Right.
and insightful. Yeah.
And that's a lot of what Western medicine misses is it works with it works with the symptom, not the cause.
I'm so glad you said that because unfortunately, I hate to say it, there are a lot of physical therapy models out there, and I think our audience know this by now, but the traditional model for physical therapy, and to your point, where it's basically one body part at a time that
Mm-hmm.
they'll cover, they even do cover it these days,
Right.
and it becomes sort of like a disconnected approach where it's like, of course the elbow's hurting, but that is when you come in with a tendinopathy or shoulder issue, whatever it is you're coming in with, that's just the symptoms that you're coming in with, to your point.
Right.
And unless you actually take a look at that person emotion or really dive into their history and spend the time there, you're not going to be able to get the clues to see that there might be something else that's the reason why they're actually in this state.
Right. And I mean, I did massage for a while in a corporate environment, which was interesting for me being on the outside. So I actually saw these people in the work environments, and it was kind of interesting watching them because they would come to me, and of course, massage my neck and shoulders, my neck and
Of
shoulders.
course.
A lot of, back too, but I'd see them at their desk and yeah, they'd be hunched over. But then I was able to watch them walk down the halls.
Mm,
And I mean, they'd come into me. I'm like, so you were limping. So, and it was just
yeah,
interesting. And, the mind body connection, they didn't realize they were limping
that's so interesting, isn't it? Yeah.
because, I mean, they're just so focused on one
Yes.
thing.
Yeah.
So it's interesting study,
Yeah, for sure.
people watching.
Yeah, yeah. It's funny because my buddies and I, we used to. I went to Columbia for my master's, and my buddies and I would go to. It's a geeky thing to do. We would actually sit in Central Park on a Saturday and just watch people run and be like, "Oh my gosh, we should give him my card right now,"
But
I'm guilty.
yeah, it's a lot of fun just kind of like watching people in motion. And then also just being reflective, like, hey, I wonder what kind of issues this person's going to have based on how they run, based on how they walk, based on how they move.
Yeah.
And it's funny because I think that those kinds of exercises allow us to really kind of get a bigger picture of what's really going on.
Yes.
Yeah.
So,
So
yeah.
talk to me about your approach in massage therapy, Teresa, as far as like, do you take any kind of particular angle when you meet someone or when you work on them?
I always start for me at the basics. Somebody will come in and I of course read their paperwork and I discuss the paperwork with them. But then I also watch them move, but not technically. I'll Some of the training I've been to, they gear more toward, okay, I don't know how to say this, range of motion tests. And
Sure.
yes, that is part of massage therapy, but I know a lot of our body issues come from emotions. So I like to connect with people a little bit more on an emotional level, just talking to people, being open and seeing what they think is going on and try to form more of a partnership with people
Like an
because,
alliance there. Yeah.
right, I don't know what you're feeling. You can tell me what you're feeling. Perception is such a large part of how we use our bodies. If you're from, I'm assuming you're around my generation. So suck it up, buttercup.
29.
29.
29
Yeah.
year.
Yeah. Suck it up, buttercup.
Yeah.
Brush it off, rub some dirt on it.
Yeah.
So we were kind of taught to ignore what's bothering us. So we just, push through, move on with life. But then it manifests in the bodies. So I try to listen and be open and bring people into their body to be aware of what's being ignored, what needs a little bit more attention.
I love that. And, I'm so glad you mentioned emotions because I would say that, especially when we have clients coming in with a chronic condition, and we have a lot of runners and hybrid athletes as our main clientele. And I can tell you, and Dr. Megan can say the same thing, the number of people just break down talking about what they can and can't do and how much they're actually holding in because of that sort of the tension of not being able to do what you love
Mm-hmm.
and not being able to release whatever you gain from exercise and activity. It could be your mental health, mental sanity. I think it is for a lot of people like myself
Yeah.
included, probably you too.
Yeah.
Yeah. And almost feeling trapped because you're like, well, I want to do this, but I can't. And it causes a lot more stress in their bodies, I think. And I think that accumulated stress over time can really be detrimental to not only the psyche, but also to our body because
Definitely.
we become afraid to move. We become less confident in how we carry ourselves as well because we're always thinking, oh, this is it's going to keep hurting me. And so, pain as that indicator can really cause havoc and run havoc in your body. And I agree with you where that can really sort of like gather the emotions in a negative way to where
Right.
it can become toxic for you.
Absolutely. And it just totally gets caught in the body. And I'm sure it's happened to you too. You have somebody working on the table and all of a sudden they're crying and they're like, I don't know why I'm crying.
So many times.
Right.
I get so
Right.
many times.
And it's just like, you know, and we're all embarrassed to cry. So it's like, I just try to hold space for those people. And it's like, I'll normally just go to a hold at that point.
Yeah.
But when people start calming down, I'm like, okay, what do you need from me? Do you need me to step out of the room? Do you need me to continue this? What do you want to happen at this point?
Yeah.
Americans are not good at dealing with emotion.
Yeah.
Yeah.
And it gets trapped in your body. I remember from my massage experiences too when I was doing shiatsu and especially I would say the pec area,
Mm.
a lot of emotional releases of that and
Mhm.
also
Yeah,
in the iliopsoas. I had one woman actually one time.
definitely that one.
One, and at the time I was not equipped to like, being in my 20s, I was like, just kind of, getting used to the world. But she started crying and I was like, is everything okay? I thought maybe I went too hard. She's like,
Right.
actually, what happened was I was abused by my uncle.
Mhm.
And just you being, and she's like, it's not your fault. It's just you being in the area actually reminding me of that situation.
Yeah.
I've dealt with it, but it's still obviously trapped in my body somehow. So
Oh,
just
she was
releasing
aware.
her. Yeah, she was very aware,
That's
but
great.
it was great. And, she had a great session and whatnot. But, I think to your point, I don't think we often acknowledge enough of the emotional component and how that can contribute further to chronic pain or even to poor movement patterns.
Oh, definitely the movement patterns for sure. For a while in my career, I worked with a lot of fertility clients because of my struggles with fertility. So it
Yes.
was a passion of mine
Yeah.
for a little while. And a lot of that is abdominal work and the amount of emotions. Because, I mean, it's a very protected
Very
area,
protected area.
especially for women, because, we're never good enough in that area.
Mm.
So working with women in that way, so many people can have a breakdown. And, it's sad, but it's also beautiful because they're finally releasing it.
Now, you have also dealt personally with some health struggles too, which caused you to take a break from massage. Obviously, you don't have to go into depth there, but what has that journey been like going from helping other people to where you actually needed help and then coming back into the world where you're helping others again?
Yeah, it's been a bit of a struggle. It happened, I went from 90 to 0 with COVID, and I don't know if it was the emotional of going from 90 to 0, because unfortunately I I wound up working too much. I
Mhm.
love the job. I have a hard time saying no when somebody needs help. So I dealt with a little bit of the emotions that I'm sure everybody in the world dealt with by being isolated. And then all of a sudden, I started having some health issues, and it brought me to awareness that I really should start practicing what I preach.
Hmm. Imagine that.
Yeah.
I've never been in that
Oh,
situation
no,
before.
no, not at all. So it was a little bit like sitting on an airline, when the oxygen mask drop, put it on yourself before you help somebody
Yes,
else.
yeah.
But yeah, I have also, it started with COVID and then dealing with some family health issues, my health issues. And now coming back, I think I'm in a better place because I am better with self-care. That's a journey for all of us, but I am still working on it. And I think I have refilled my cup a little bit in
Hmm.
order to help other people again.
That's great. And it's funny because I think those moments also teach us the empathy and also a reminder that, like you said, we definitely need to be taking care of ourselves as well.
Right.
I am 1,000% guilty, which is one of the reasons why I needed to see you that day. I was like, I got to practice what I preach and,
Right.
and whatnot too.
Right.
And I really love what I love about massage is that it's such a great adjunct to physical therapy because on the one side, yes, we are working patients hard and we're doing regenerative stuff to help accelerate people past pain. But I think because of the activity level that a lot of people do, there needs to be something else that we do to upkeep the system, if you will.
Hmm.
And just like you, I think the kind of clients that we work with best are the ones who see health as an investment to
Absolutely.
become the best version of themselves.
Hmm.
And if there's massage, there's nutrition, there's strength training, there's physio, there's other wellness factors that are into that that can really help for this person, especially if you're over 30, to really maximize your health. Because yes, there is a downhill component to
There
life,
is.
amazingly, but we can mitigate the effects of that
Right.
by doing all the self care that we can. And so I'm hopeful for people listening to this that wherever you may be, that you do consider massage therapy as part of a way to get to maximize and optimize yourself physically for the kinds of activities that you love to do.
Right. Massage can be very challenging depending on what you're coming in for because it doesn't always feel great.
Hmm.
With massage, we can mitigate that even in that 60, 90 minutes, whatever. It's like you can work some of the relaxing modalities and then work in some of the work as well. But mas- massage, physical therapy, it's not a luxury. It's part of the self-care. It's an important part of the self-care because
I
with
agree. Yeah,
massage, you get a mental break as well.
100%.
Right.
Yeah, I think in that way, it's a good way to like. What I love about going to massage is that and I don't say this in a negative way. I get to disconnect from everything outside
Oh,
and
that's
just
perfect.
no one can bother me in the session.
Right.
My phone is on airplane mode. My watch is off. Nothing's dinging or anything like that.
Right.
And it's a chance for me to get centered again.
And people don't put enough importance on being centered, being in their body, being present.
I don't know about you, but I would say about 25, 30% of my mind goes in the future. And the rest of it is, I would say in the present, I've been better at that and staying out of the past. But for me, I need to stop thinking about the future a bit. And when I go into massage session or do meditation, it allows me to get back into that present mindset.
Right. And I mean, it's just so helpful for, I mean, I know it's helpful for physical, but it's just so helpful for mind. And we just don't take the time to slow our minds because we have constant input. So, and that's one of the great things about being in a massage room is no input.
Yeah.
You know, I have some clients, they come in and they want to talk, which is fine. If that's what they need, because some people are so isolated. They work remotely. Their families are all remote. So coming in is a way of connecting sometimes.
1000%.
But then there's other people who never shut down. So being on the table is just that's your excuse.
Yeah.
You know, my phone is over on that table. I'm on this table.
Far to reach.
Right. Right. And, you know, I have had some clients that come in and forget to turn off their ringers and, you know, and we're all, like I said, going a million miles a minute. So yeah, we forget to turn off our ringers. So I'll like, do you mind if I turn that off? Most of the time it's yes, please. I'm sorry.
It's funny. You know, it's funny because some of the moms that we would treat would be like, hey, this is the only place and no one can reach me. So I was like, oh, that's good. I'm glad I got you a break then.
Right. Right.
So now, as a massage therapist, what are some of the common conditions or diagnoses that you treat or areas of the body that you treat?
Do general all over massage. I have worked a lot with, you know, it's funny that people say the universe gives you what you need at the moment.
Oh, yeah.
I've gone through cycles of, okay, I do all fertility. Okay, I do all pregnancy, and not necessarily in the order you would think that would happen. And then I would have like all of these rare disease people coming into me.
Oh, interesting.
Yeah. So and then for a while I had all geriatric.
So it goes almost like cycles.
It really does. So, I mean, it's all of us, neck, shoulders, back.
Is your favorite area you like to treat? Or it just depends on the person more?
It depends on the person.
Yeah.
People, their energy melds a little better. Some people, it's a little, you know, you walk into the massage room, it's the right color, it's got the beautiful music playing. Some people don't like that music and we will change it. But it's more, I think I just like bring people down because we're all in a heightened state all of the time. So I think that is my favorite part of massage, is just bringing them down out of the ethos.
Yeah, sure. There's a great book I read called The Ruthless Elimination of Hurry. And as our conversation was unfolding, it really reminded me of the book that I read. It was probably a few months ago. And one of the things in there was, you know, obviously getting into nature. And the author also mentions massage. And I'm like, 100%. This is something that needs to be done just to kind of get out of the hurry. And I'm definitely in a rat race. I feel compelled to get things done. I'm very ambitious. Exactly, part of the culture as an entrepreneur. But I think that when I'm in massage sessions, definitely causes me to slow down and to reflect a bit more. And I think even I used to really crave deep pressure, deep touch back in the day.
Right.
And as I've gotten older, for whatever reason, I think just being on a table.
You have a little bit of Pavlovian.
Really does. I mean, that in itself is like, oh my God, I feel so much calmer already. And my brain just begins to like unwind from that.
Right.
So light touch is enough for me at times too. How do you work with people who may need to come down, as you said, but may have a hard time sort of centering themselves in a session?
So we have different techniques in massage, which I'm sure you know, is the rocking, the vibration, and you know, sometimes even skin rolling will bring somebody down.
Oh, that's a good one.
Right. So I do often remind people to breathe.
Yes.
Because we don't tend to do that either. I've had to talk people through belly breathing at
Yeah.
times. So everybody's different. And that's part of what I love about massage is, yeah, in school we're taught a routine, but you approach everybody as an individual.
Yeah, I love that. I love what you just said there because I feel like in physical therapy as well, for every 100 back patients that we'll see in a year, everyone presents so differently. Everyone's got a different story. Everyone's got a different activity level.
Mhm.
Everyone has injured their back differently. And so there's so
Yeah.
it becomes sort of like that problem solving piece that we want to try to figure out. And
Mhm.
that's what's so exciting about it.
Yeah. It's never the same.
Never the same.
Even the same person.
Exactly.
Depends on what they experienced the last
Yeah,
month.
and with that point, we may have patients doing some of the same exercises as a foundational segue into other things they do functionally, but along with that comes, well, they're going to be doing different kinds of weights, and they're going to be doing different kind of tempo, and their purpose is different for why they're doing it. So I have never been bored in 20 years of doing this, and
No.
you're probably the same way with massage.
No.
Yeah,
I mean, even you were saying that you like the deeper pressure.
yeah,
That feels different from day to day.
yeah,
And your perception of deep pressure is totally different from my perception.
yeah,
So I'll have people say, okay, do you do deep pressure? I'm like,
yeah,
yes, but I'm still going to check in with you
yeah.
because one day it might be too much and the next day it's not enough. So it's,
Yeah. I love how you and were talking about how even among massage therapists, and I would say the same thing among physical therapists, you can have somebody who's very technically sound, but not be a great massage therapist.
yes.
Let's talk about that.
So I always, growing up, I grew up with my grandmother being a musician. My grandfather was a musician, and my grandmother played everything she touched by ear.
Amazing.
So everything was emotion. And then you can hear somebody else play the same instrument and they have all the technique right. And the song doesn't sound right.
Hmm.
So with massage, I've been to some very good technical massage therapy sessions myself. I'm like, I could name the strokes they were doing when they were doing it. But if they're not connecting with your presence, with your energy, it's not going to be as effective in my, it's still effective. But I think doing it with the presence, with the breath, with all of the energy, everything, massage is kind of like a dance. So if you're not doing it all as one thing.
Yeah. We talked about partnership with our clients, and there's something in physical therapy called therapeutic alliance. And I really think that I would say as a clinician, my biggest strength is actually the connection piece, where if I can connect that person and gain their trust in a very good way, not to
No,
manipulate them.
no, I get
Yeah.
that.
That I think is the stage one of that therapeutic process. And I don't think that I can be successful in getting them to buy into what I have to get them to do or to think differently about their condition to put them on the
Right.
right path unless that connection is there first. And there are many ways to get that, of course. But I have found that I've seen many physical therapists over the past 25 years who are great technically.
Mhm.
I would never hire them because I could tell that they're just not people. And there's something to that with our field and your field where if you don't have the connection with someone, there's just no way that you're going to be able to inspire them to do the things to get back to where they need to be because they're going to have to be coached at different points. That hey, we're
Right.
going to get there. This is how far we've come. They need their hands to be held, and to put them on this journey where they're going to be investing, obviously, in their time
Yeah,
and resources.
absolutely.
You want to make sure that every session really does count. And unless we have that connection with that client from the get-go, I don't think we can get to the results they're looking for.
Right. The relationship is
Yes,
huge.
huge.
And you, as a physical therapist, I'm sure you have it as well, the power differential. I mean, people come in to me and, I always say undress to your level of comfort, but that's different for everybody.
Definitely.
But you're in various states of undress on the table and I'm standing over you. And I've been in bad situations like that. So I'm very empathetic to the client's comfort. It's like, okay, if you're uncomfortable with this, we can change something up. So is a privilege.
Yeah.
Somebody's trusting me with
Huge.
their body and their energy. And it's a privilege to have that.
Yeah. And I think that takes a level of humility too, where I know there in every field we have this where, some people think they're the best thing since sliced bread. And
Some
or
people might be, but
but always approaching each session, each person with humility and thinking in my mind, I'm like, what can I learn from this person about how they move, about what their history is, that will help me to solve the issue that they're coming in for. And the humility piece is really important because, if you go in, I have unfortunately made the mistake in my younger years of thinking I knew what was going on and being totally off because I
we've
was
all done
brazen
that.
about like,
Yeah.
oh, that's what it is. And I couldn't have been worse. So those lessons I've learned have taught me that I have to approach each person as n equals one. Like this is the first person with this issue that I'm seeing.
Right.
How can I open my mind to what they're going through so that I don't bias myself into treating them in a certain way?
100%. When I was working too much, I had caught myself a couple of times, sometimes mid-session going, okay, they came in saying this, and I'm doing this so often. I'm like, nope, okay, I need to step back a little bit. This person is completely different. Their issues are caused by something in their world, not what the textbooks.
Yes. That's right. Oh my God. You reminded me the first couple of years, it was very textbook for me. And I think there's some of them that's needed because
You need
to
the structure.
yeah, structure.
Right.
But
Until
it's
you get
obviously
the experience.
yes, definitely. So talk about and I love how you have pushed yourself. This has been the year for you,
I'm
Theresa,
trying.
where you're going to be making some moves and doing things that maybe are out of your comfort zone.
Yes.
What inspired you to want to do that? Because I think it takes a certain kind of courage and initiative to want to do things that are out of your comfort zone as a professional, as an entrepreneur, as a massage therapist. What's one thing for
Trying all of
you?
those.
What's one thing for you that you are trying to work on this year that's out of your comfort zone?
Being a little bit more social. I am inherently an introvert. COVID just like led me right into my comfort zone
Oh, you
in
had a great
some
time.
ways.
Yeah.
In some ways.
Yeah.
So it was now my child graduated from high school. So one of the people I was caregiving for has transitioned. So now I don't want to always do what I've always done because I don't like the results. So I'm trying to grow and do things a little bit differently.
Yeah.
And along comes this one client and says, hey, do you want to do a podcast?
And here we are.
And here we are. And my initial reaction was no.
Yes.
I know. But I want to start experiencing new things. I've helped everybody else, and that will never change. But now I need to make a little bit of balance and help myself.
Yeah.
So that's kind of what changed this year.
I'm excited for your growth and your
Thanks.
desire to seek those opportunities. I think that number one, you own a business. So
Yeah.
I think that in itself is the best way to develop personally, for myself included.
It's been up and down.
And it always will be.
Yeah, absolutely.
I would say for myself, I am also a functional introvert. And many people get surprised when I say that, but I would rather
Yeah.
be in solitude. I get a lot of strength and recharge from being away from people. Even my kids would know this, that daddy needs his time.
Right.
Yeah.
Yeah,
And
my
I can-
daughter's well versed. Yeah.
There could be hours where I'm just like by myself, just thinking, reflecting. That's what I love and crave.
Or just not.
Yeah.
Just zoning. Yeah.
And so then it's funny being when I'm in public, obviously I have to be a certain way. And I think being a business owner has allowed me to grow in that way where working on social skills, working on how to talk to people, working on how to make small talk. This is something I was not good at before. And I've gotten better over time. But ways to engage with people at their level so that
Yes.
we can create that connection and a relationship. But that I wouldn't have gone had I not gone into business for myself. So very appreciative of those moments and lessons.
I had the small talk thing down with retail. You don't have a choice. The business thing, I walked into it going, I have a business degree. This is going to be a piece of cake. Yeah. It's totally different from the corporate world.
Oh my gosh, yeah.
But when you love what you do, it makes it a little bit easier. I still hate paperwork.
Oh my If you ever want to interrogate me, make me do paperwork. That is my
Right?
thing. It's like the worst
Right.
thing.
Networking I'm working on because as a functional introvert, networking is a little
Yeah.
difficult, but I keep meeting awesome people like you.
Oh, thank you.
And I am starting to rebuild my little cache of, okay, this is who you need to go to. Because, we all like to think, okay, I can fix this problem.
Yeah.
We need help. We all work in partnership.
Oh, yeah, for sure.
So yeah, right out of school I did that. I can fix it. But then I was like, okay, this is a little bit above my skill level. And I've even referred people to other massage therapists.
Mhm. Yeah.
So I'm like, you specialize in headaches, you specialize in sports, and like I think you might get better results with this person.
See, I love that. And I appreciate that too. I would the same way where if somebody, especially if somebody has pelvic floor issues,
Yeah.
I've treated pelvic floor, but I would rather have them go to a specialist. And so we have a network of people that we refer people to. But yeah, I think it's important to know what lane you're in,
Yeah.
and also who's in the other lanes where you can refer people out to.
Right. I mean, I've had people come in with chronic headaches, and some I absolutely have great results with. Some I just can't do it.
Mhm.
Unfortunately, my headache person moved to Hawaii. But
I'll
we'll work
stop
on
on
that one.
Awesome.
Yeah.
So, Teresa, how can people find out more about you and work with you if they're in the Cary or Raleigh area?
So I do have a website.
Mhm.
It's ttmassage.com.
Okay.
I am working on building the social media aspect of it.
Mhm.
So I do have a Facebook page, not very active. My daughter is saying that she's going to help me get the rest of it up and
Of
going.
course. Yeah.
Yeah, I think TT massage is the best jumping off point.
Great. I will leave
And-
that in our show notes so that people
Okay.
can refer to that.
Okay.
And we'll also make sure that on our email campaigns to our clients that everyone will know who you are.
Oh, thank
and
you.
this episode will also go live.
Thank you.
Yeah. It's been a pleasure. Thank you so much for coming on our show,
Thank you.
Teresa.
And thank you for making it easy.
You're welcome.
Thanks so much for tuning into today's episode. It really does mean a lot to us. And don't forget to like, share, subscribe, or comment if you got at least one or two helpful insights or takeaways to help you get to your next level.